On this presentation, we will be discussing Pathways to Boards, a quality improvement pilot project for residents to enhance virtual pathology engagement at DMC Wayne State University. Pathology is a fundamental discipline for medical learners at all levels. It is a core medical school course and it is ubiquitous on every board examination, pathology and non-pathology alike. As technology advances, we are seeing digital pathology and virtual microscopy become increasingly integrated into pathology education. In fact, competency with digital is now required by the AB Path board examinations and often in clinical practices. Currently, trainees have limited exposure to digital microscopy. At DMC Wayne State University does not currently have in-house digital microscopy outright. This can lead to variability in the diagnostic confidence and board preparedness in trainees. For this reason, Dr. Jamin has developed and implemented a educational initiative called Pathways to Boards. Pathways to Boards is a virtual case-based pathology teaching initiative that is designed to improve diagnostic reasoning and culture interactive discussion, as well as increase familiarity with digital pathology resources. Cases utilized in these sessions are obtained from Leeds University Virtual Pathology Repository, which provides high-resolution digital whole slides. The case links are provided to the trainees 5 to 7 days before the sessions, allowing trainees time to independently review the slides. Sessions are then conducted virtually via Zoom, utilizing an informal discussion format. This provides a low-stakes environment where trainees can describe microscopic findings, generate and discuss differential diagnoses, observe example diagnostic reasoning by attending pathologists and senior residents, and learn the key morphologic features and diagnostic pitfalls. The image on the right is a visual example of the platform. With this project, we pursued several objectives. The primary objective was to improve the learner's exposure, comfort, confidence, and with virtual pathology through our Pathways to Boards educational sessions. In addition to this, we had several secondary objectives, including increasing learners' engagement with digital pathology resources, promoting independent case review, improving perceived preparedness for board examinations, and using participant feedback iteratively to refine and improve the session format. This project was implemented as a quality improvement initiative. To evaluate the effectiveness of the sessions, a post-session anonymous questionnaire was electronically administered to all participants, which included pathology residents PGY1 through PGY4 and medical students who were rotating pathology at the time. The majority of the survey questions were Likert scale questions that were scored from 1, strongly disagree, to 5, strongly agree. This allowed us to assess multiple domains of educational impact, including engagement and learning experience using the digital format, content quality and educational value, confidence and preparedness for pathology board exams, accessibility, efficiency, and usability of the digital format, standardization, and educational equity. The survey also contained open-ended qualitative comments that allowed participants to provide feedback and suggestions on the strengths and weaknesses of the Pathways to Boards sessions. The survey feedback was reviewed and used to guide iterative improvements to subsequent Pathway to Boards sessions. It is important to mention that at the time analysis for this presentation, we had 14 unique responses. Overall, our results demonstrate high levels of engagement and positive perceptions of the educational value of Pathways to Boards. The chart seen here shows the average scores out of 5 on the Likert scale for key evaluation domains. You can see that each domain received an average score of over 4, showing us that learners viewed the sessions as engaging and providing enhanced learning, better understanding, and value beyond independent board preparation. The highest rated outcome was the perceived reduction of prior exposure gaps to digital pathology, suggesting that these sections may help address the variability in case exposure during training. This graph shows the average scores out of a possible 5 on the Likert scale for the different aspects and objectives of the session seen on the left. These results showed that learners felt that these sessions were easy to access, standardized, respectful of time, helpful in reducing gaps in prior exposure, and improve the ability to reason through unfamiliar complex cases. This graph does contain 2 domains. After sessions felt more confident approaching board style questions, and sessions increased overall preparedness for pathology boards. These were rated 3.79 out of 5. Of all the questions using the Likert scale on the survey, these two were ranked the lowest, but they are the only two components that are ranked below 4, which indicates that overall there are consistently positive learner perceptions across all evaluated domains. This graph is a continuation of the graph seen on the previous slide. The results show sessions clarified high-yield diagnostic and decision-making, improved conceptual understanding, and were engaging at a difficulty level appropriate for board preparation. It can be seen that all domains, including the graph, were scored as over 4, once again reiterating the consistent positive learner perception across all evaluated domains. A crucial component to this project was the learners' perceived effectiveness of later Pathways2Boards sessions compared to earlier sessions. After receiving early feedback, we used the comments and suggestions provided to implement changes to subsequent sessions. After doing this, 15.4% of learners said that the sessions held about the same effectiveness, 15.4% said that the later sessions were more effective, and 69.2% of learners stated that the later sessions were much more effective than previous sessions. This shows that the change is made to sessions based on the provided feedback, improve the sessions, making it better for learners. Qualitative feedback provided additional insight into learners' experiences with the sessions. The value of discussion-based learning was shown by respondents' emphasis that the interactive format allowed them to better understand how experienced pathologists interpret microscopic findings and generate differential diagnosis. Observing the diagnostic reasoning of senior residents and faculty provided insight into real-world diagnostic processes. The low-pressure learning environment allowed the learners to ask questions and engage in discussion without the pressure often affiliated with formal teaching conferences. The learners also expressed that exposure to detailed microscopic descriptions and reasoning provided valuable examples to learn from. Our results also included some observed learned behaviors. These included progressively increased participation by the learners as the sessions continued and increased independent review of virtual cases, suggesting that sessions help the learners become more comfortable with handling complex and unknown pathologic virtual cases. We also observed increased post-session use of digital pathology platforms, including the Leeds University resource. In addition, there were some changes we implemented based on feedback that improved the session overall. These included clarifying when learners should respond during sessions, ensuring the broader participation of all learners as compared to a select few, and the possibility of incorporating board-style questions or additional case info into sessions. Learner feedback provided insight into their experience during Pathways2Boards that directly informed improvement in the session structure. These sessions provided meaningful educational value to learners that help enhance their diagnostic reasoning and their engagement with digital pathology. The learners reported high levels of engagement and perceived improvements in conceptual understanding and diagnostic reasoning. The sessions being online allowed increased attendance and accessibility, allowing learners the opportunity to observe how experienced pathologists approach slide interpretation and differential diagnosis, suggesting virtual platforms may be an effective medium for collaborative pathology education. Another important finding was respondents' indication that these sessions helped address gaps in prior exposure to digital pathology, which highlights the potential value of structured virtual slide discussion and pathology training. Overall, these findings support Pathway2Boards as a promising model for integrating of digital pathology resource with discussion-based diagnostic reasoning. Our project had a few limitations that should be acknowledged. The first is that Pathway2Boards is in its early stages of implementation, which means we only have a small sample size and therefore a small number of respondents. Additionally, the resources are generated from our single institution and have not been implemented on a larger scale. Lastly, the surveys are based on self-reported perceptions rather than objective matters such as knowledge acquisition or diagnostic accuracy. Future efforts will focus on expanding the program and strengthening the evaluation methods. These efforts will include incorporating additional board-style questions, expanding case diversity and subspecialty representation, conducting longitudinal evaluation of learner outcomes, integrating Pathway2Boards sessions more formally. Further studies may explore how structured digital pathology discussions influence diagnostic confidence, visual pattern recognition, and board exam preparation. Thank you very much for your time.